Hello, my name is Melissa. Today I will be presenting about my capstone project and reflecting upon the project that I did. Just a little background, I am a nursing student at Utah Tech University. I work as a nurse case manager in a home health company. So my project setting is within that home health setting. A little background about how I chose my project is we often do huddle meetings and safety meetings, and we commonly address some of the problems that we're experiencing within our company and how we can improve. So my project was recognizing and reporting sepsis in the home care setting. So I chose this because this had actually been brought up in a meeting that we were finding that our home health patients were being admitted to the hospital or readmitted to the hospital for sepsis. And then when we were looking back and doing chart audits, we discovered that there were times when either the nurse did not report vital signs or signs and symptoms that could have indicated sepsis, or they did not recognize that those were signs and symptoms of sepsis. Either way, there was a lack of documentation in these cases, and it was unclear whether they reported, or if we went back and asked them, they did not report. So this was something I really wanted to address within our company. So just kind of reviewing. So the main focus of my project was to provide education to nursing staff on the signs and symptoms of infection and sepsis, as well as reviewing the appropriate process of documentation and follow-up. When I started the project, the initial benefits I thought I could provide to the company as well as to staff was reducing hospital readmission rates for sepsis, improving patient care, and focusing on improving community health. I think that benefits the company as well, because if we are providing a better standard of care, this reflects better on the company. This shows within the community we're more likely to be recommended. Improving care can improve our HCAHPS star ratings, and that also reflects good on the company. So the mentor I chose was actually one of my managers. I chose her, well, first of all, she had the qualifications that were required. She has her master's degree in nursing. She has about 25 years experience in the nursing field. And just she herself as a person has qualities that I admire in a leader. I definitely respect her and look up to her. She's always kind and compassionate. She always shows the employees below her, who she's managing, she shows them respect. But she's still, firm and does her job correctly, but she has that really good balance of not being too harsh, I guess, but being firm enough to get what needs to be done. So that's why I chose her as a mentor. So just kind of going into more about my project and what I did. So what I ended up doing was presenting a PowerPoint along with talking a presentation as well. So coming in with the PowerPoint as a visual aid and speaking about sepsis and education and all of that. So just kind of the main points you can see on the side here is I created a PowerPoint presentation and presented it in a staff meeting. So all staff was present for that. I created laminated badge cards that correlated with my presentation. So, as you can see here, this is just a little sample up at the top here of slides from my PowerPoint. But in this little section, I reviewed the vital signs and symptoms of sepsis. So you can see all that here. I included this mnemonic I thought could be helpful that actually comes from the Sepsis Alliance, just to kind of express this is the situation where it's very severe. You need to get this patient to the ER. So I made my laminated cards here correlate with the information that I shared in my presentation. And so these are cards that they could stick on their lanyard or their badge. And I thought that would be helpful in terms of a good reminder and having everything come together. So yeah, my PowerPoint included of all of this, just the definition of sepsis, facts about sepsis, the signs and symptoms. I also shared some examples of times, they were real life examples of situations where nurses didn't report appropriately, or didn't document that they reported, or didn't acknowledge that there were signs and symptoms of sepsis and the patient was hospitalized. So there were two situations that I reviewed, explained how we could act differently next time, and showed kind of the real world consequences for patients when we are not recognizing these things. So with my project, there definitely was a lot of collaboration that went on. So some of the successes and difficulties, I think some of the successes are, my mentor, when I came to her and told her what I wanted to do for my project, she was extremely supportive. She was really open to anything I really wanted to do. I was open to discuss anything. She actually came up with the idea of me presenting in the staff meeting and helped me facilitate that. She, a lot of the time for me planned on me presenting. She gave me a nice introduction in the meeting explaining that my presentation was for a capstone project, and that and that it would be about sepsis. So it made it really easy for me to just kind of step in and do my thing there, and make some of the difficulties or challenging parts of trying to collaborate. In home health, all of us work remotely and our schedules can vary. So I technically work from 9 to 5, but I'm also, sometimes it goes beyond that, before that, just depending on when I can get out to see patients. I'm driving to their homes. My boss isn't always in the office either. So none of us are in the office really at the same times. We stop by to grab things or whatnot if we need to be there for some reason. But so that makes it difficult because we're not seeing each other every day, where most of our communication is through like Teams or messaging or calling each other. So just having those crazy schedules made it difficult sometimes to get together and talk about the progress of the project. And then at one point, my mentor gave me the idea to reach out to a colleague who was performing these chart audits that I spoke about. And so she gave me her contact information, and I had reached out to this person several times over months, and she would message me back, but then not follow up, or we could never find a meeting time to get together. So that did present a challenge where I was like, oh man, I don't know if I'm going to be able to look at these audits that she has. So that was a little bit difficult, but I was able to approach my mentor about this challenge. We worked through it. We actually found some different examples that we were able to pull from our own safety meetings that we do. She helps me bring that up in the meeting and talk about, if anyone has any safety stories relating to sepsis, and if there were any misses or ways that we can improve, we could share that. And I was able to find some situations that I could use as like a case study or a real life example. So it was great that she helped me overcome those challenges. So just kind of overall evaluating how my project went. I think what I did achieve with this project is I did provide education to the nursing staff on sepsis prevention. I was able to collaborate with colleagues, and I was able to really focus on improving patient care. So those things, I think, those goals that I had set out for myself, I feel like I did accomplish. Benefits to the organization. I mean, it's hard to say for sure now, but hopefully, I think that there's a possibility that it could help reduce rehospitalization rates due to sepsis and improve patient care. Therefore, improving reimbursement, improving how people rate our organization, how we look to the public if we're providing good care and quality care. Our ratings and that kind of thing will reflect that if we show that improvement. Just for as far as like the benefits to my own professional growth. So this this presentation that I did actually went very well. I was then asked to present this to other home healthcare departments. So like I'm in the Salt Lake area. They asked me to present this to the Ogden area and to the Provo area. So for me, they thought I did really well on this project and gave me a lot of compliments about it, and thought that I put my presentation together very well and provided good information. So just growth in that way, it kind of showed my managers that I can be a good educator and show some skills as a leader. So just in my own job position, it really has helped me kind of expand my role a little bit and be more of a leader. It improved my ability to communicate and collaborate with colleagues. I was, kind of pushed out of my comfort zone and pushed to talk to people that maybe I wouldn't have normally talked to if I didn't take on a project like this. And it also pushed me to take some initiative to create change, to recognize a problem and address it. So I think as far as my professional growth, this project helped me in a lot of ways. So just concluding, so the main focus of my project was to educate staff on how they can prevent sepsis in the home health setting. I created a presentation. I presented that presentation in my staff meeting. I gave out laminated badge cards that correlated with my project as reminders. Afterwards, I emailed surveys to my coworkers, just kind of to try to assess the effectiveness of my project. I didn't get too many responses back. I got 4, I believe, but they said that they think that the project made an impact, that it was impactful, that they learned something new, and that they will try to take the information they learned into their practice. So I was happy about that. I also just got positive feedback from management saying that they thought it was an impactful presentation. So that was great. And just the impact for me on my future practice, I would say I have more confidence to initiate a project like this again or initiate some change. It's definitely made me think about and consider my future career goals. I do have an interest in research and education. I definitely researched a lot about this project, citing scholarly journals about sepsis prevention in the home health setting. So I spent a lot of time doing that. Also educating others is something I really enjoy. So it kind of just opened my eyes to that, like, could there possibly be a role for me in the future as an educator or something like that? And then just within the position I have now, it actually has opened doors for me within this position because I've been asked to educate more about this, and they think that I did a good job on it. So overall, it's been a really good experience, and I think that's about all I have to say about that. But thank you so much. And hopefully I can stop this recording.